It's a real pleasure to be here in your beautiful city and beautiful country. I'm so grateful to the organisers for inviting me, and it's so wonderful to be back in a face-to-face meeting and not seeing everybody on Zoom. So I'm going to talk about transition. It's a topic that's very close to my heart, and I'm going to talk specifically as a healthcare provider about some of the specific issues that we need to think about in young people with Dushen-Becker dystrophy. These are my disclosures. So let's start. Why is transition important? So a lot of healthcare providers get confused between transition and transfer. Transfer is going from adult to pediatric services, but actually transition is the process of growing up. It is a process. It takes several years. And we talk about transition for young people. So a young person is someone aged between 12 and 25, and that is my definition. And there's been a great deal of research in other healthcare areas. As we've heard, it's quite new for Duchenne and Becker, but in other healthcare areas, there's been lots and lots of research on this, and particularly, for example, in diabetes. We know that attitudes and belief systems that develop in this age group can have a lifelong impact on the health and outcomes in the longer term. So it's a very, very important topic. It is normal for teenagers and young people to sometimes do risky things, but it is even more common in people that have chronic health conditions, and that also can have an impact on their future. And also, this is a time when the brain is developing faster than at any other time in your life. And we know that often mental health issues will arise during this period. So actually, we're going to talk a lot about psychological and psychiatric support. And in all young people, if they have a condition or not, depression is more common. So it's more common if you have a condition. And there are specific challenges for our young people that attend our services. Firstly, you have highly complex medical needs, so you have to see lots of different specialists, lots of hospital appointments. There are issues in teenagers about body image, and this can be really impactful on quality of life. And for all young people, and particularly our group of young people, there is a problem of feeling stigmatized by your peer group at school, college, university. There is a problem of social isolation if you don't prepare for adulthood when you leave school. And if you don't prepare in advance, there may be fewer opportunities in the future. And finally, very importantly, just when you should be becoming more independent, you are needing to be dependent on other people for your activities. In the United Kingdom, each country has produced many, many reports about the importance of transition. And I've decided to pick this particular report by the Quality Care Commission in the United Kingdom. This is a body that goes around and inspects hospitals to make sure that they provide good quality care, and they give hospitals ratings for how good or how bad they are. And in 2014, they published a report, you can download it on the internet, to a report on transition for young people with chronic neurological disorders. And within that group of young people, they described transition for young people with Duchenne. And in their summary, they concluded that actually in the United Kingdom, transition was inconsistent. It was often, there was poor planning, and many of the health professionals were not clear about the process. That guidance and protocols which were in place were often not used, or some people didn't even know about them. And also in the United Kingdom, it may be very different here, but in the United Kingdom, some children's hospitals would discharge children at 16, but the adult services wouldn't take them until they were 18, so you had this gap. What would you do about that? And so there seemed to be a lot of confusion about the process. There was a lack of funding, a lack of acknowledgement of the needs of both parents and carers, as well as the needs of the young person. So for example, everybody seemed to know and want to do the right thing, but they weren't working together. The adult health workers weren't engaging in teenagers because they weren't funded to do it. And it was felt that the responsibility for funding should be agreed very early in the process. And very importantly, the needs of parents and carers have to be addressed, because many parents said they felt abandoned by health and social care at this most difficult time. And when they talked to adults and asked them about their views of what it was like transitioning, most of the young people said they had a negative experience. They were just left to get on with it. And no one was responsible for coordinating their care, and they didn't feel sufficiently prepared for this transition. And many parents had to literally fight to get the same level of care in adult services as they did in children's services. So in my own service, we have a very big adult neuromuscular service. We see 6,000 outpatient visits a year. And we have a specific clinic designated for young people over the age of 17. We have a big cohort of over 650 patients now, a lot of patients with Duchenne dystrophy and spinal muscular atrophy. And most of our patients, I'm pleased to say, do transition uneventfully. Most of my patients go to university or go to work. Many live independently. Many have their own families. We have 5 Duchenne adults now who are parents. But some people have more transition challenges than others. And the sort of transition challenges that we encounter in our service with our young people are predominantly non-attendance, failing to attend appointments, because actually when you leave school, go to university, life is really busy. You want to get on with life and enjoy it. But if you don't understand why you need to come to clinic, you don't come. Now, a lot of adult services would just discharge adults, but we go out and actively chase people and bring them back into the service. Often, you know, in the adult service, you'll just get a letter telling you about a clinic appointment. So we have to change the way we communicate. So we might send a text if we don't hear from someone, and that often works. We see a lot of problems with compliance, so people who become afraid to take their medication for their heart, or who are afraid to use the BiPAP machine, the ventilator, that's so important. And I quite often get emails and texts at the weekend from somebody at university because they've run out of their supply of steroids. These are all issues related to transition. And we've also seen risky behaviors as well, excess alcohol intake, drug use in our Duchenne population. Not in many, but in a small number. So a few years ago, myself and my colleague, Jatin Patney, he's a clinical psychologist, we decided to audit the transition experiences of the young people attending our hospital. There were a lot of young people coming to our specialist neurological hospital. We sent out a questionnaire, and then we also did a focus group with a smaller number of Duchenne families. In terms of the questionnaire, there was very clear evidence that people's conditions had a big impact on their quality of life. Almost a third of people were not in work or education. 60% felt the condition had prevented them from achieving their academic work or ambitions. There was a very high incidence of anxiety and depression, and a very high number of people reported how their condition had a significant effect on their social life, family, or hobbies. And 3 themes came out of our qualitative work: feeling stigmatized, feeling different, being at school or college and not feeling the same as your peers, having to be dependent on family and friends. And the other thing that was very important to our young people was peer support, being supported by other young people. So following that audit, we established a young person peer support group, and this was facilitated by our child psychologist. They had monthly meetings on a Saturday, probably not so good for here, but the first hour was just a general chat, getting to know each other and catching up. And then the second half of the meeting was practical, taking people out to cafes, restaurants, places they hadn't been to on their own without their parents before. And one of the advantages of COVID was being able to do Zoom meetings. So now this support group is held via Zoom, and it's been highly effective in boosting people's self-confidence and self-esteem. So I'm going to talk a little bit now about how can we prepare young people for this transition, and what are the guidelines that are out there. Well, in 2018, the European Neuromuscular Consortium had an anniversary workshop in Milan, and this was on shared decision-making and how important it is in healthcare. So shared decision-making is linked to good medical outcomes and good quality of life. And it's about the medics and the medical teams developing a partnership with the person. And it addresses the issue of patient choice, so that both the patient and the doctor play a role in managing their condition together. And in order for this to work, it involves sharing information in an unbiased manner. It also involves the patient or the young person developing support through their friends, family, or anybody else they wish to choose before they make decisions. And then having this negotiated agreement with shared responsibility between the patient and the doctor for that final agreement. So we have to actually start to prepare young people for being able to participate in shared decision-making, because in pediatrics, it is a family-centered approach to medicine, where it's the parents and the doctors making the decision. So we have to have a shift in paradigm from this family-centered care to patient-centered care. And so how can we do this? Well, firstly, it's really important that we provide education and information to those young people so they understand their condition and they understand what options are available to them so that they can make informed choices. We also have to guarantee their autonomy, their independence, so that they can be involved in decision-making. And we need to support them so that they don't feel anxious, because it's normal if you're young to feel anxious to be involved in making these decisions about your own health care. And that support can come from family, peer support, from school, and from advocacy groups like Little Steps. So it's really important we create a positive vision of the future, that we develop a pathway or a passport so we can monitor the process of that young person during this transition period, giving them information in a form that they can understand and they want to read or hear. Providing a mentor or a coach is really important, so a key worker for adolescents is really important. But also we need to coach and support parents. We need to help parents to be able to support the young person in making those decisions, but for them to be able to step back as well, so that they don't lead in that decision-making process. As I said, just peer support, support of other young people is really, really important. And adult services need to also recognize that a young person goes up to 25, we have to provide the same level of support for young adults as we do for young children. And there needs to be very close working between joint clinics for both pediatrics and adult services. So there is no fixed age at which a young person should transfer to adult services, because everybody matures at different stages, at different ages. But the young person needs to be fully informed, so we need to ask them the questions to make sure they understand what's going to be involved. They need to understand about confidentiality issues. And we as healthcare professionals need to understand how anxious they might be for taking responsibility for the healthcare and provide them the appropriate support so that they can feel in control to make the choices that they want to make for their healthcare. And this is where psychological support is really, really important for this particular age group. We like to encourage participation and to prepare for that from an early stage. So you've seen in the video how important that is. Developing hobbies, developing friendships, team sports, pets, as you've seen, the service dogs are so important for developing that network of friends for when you leave school or university. And it's important for the healthcare workers to support people in further education if that's what they want to do, or in going to work. Think about the future. Think about how you're going to get about. Will you drive? We haven't talked about driving, but I have many patients who drive themselves, or other patients who choose to have someone to drive for them. Where will they live? Will they live independently? If someone is going to live independently, or even if they live with their family, they have to learn how to manage other people, how to manage and employ care workers, for example. And we need to be open and talk about relationships. We saw some lovely examples in the video earlier about meeting partners, about having families, and genetic counseling. You know, ensuring people understand that you can have healthy children if you have Duchenne dystrophy. So finally, these are just the key aspects of transition that we all need to be aware of. We have to think about it from a young age. So it starts at the age of 12. And we need to be involving the young people in their plan from as early as 13. We need to be treating them as equal partners. We need to be supporting them to make their own decisions so that we can foster their independence and agree goals with them. And we as healthcare workers need to link with social care and education. We need to provide a lead worker, a key person to lead for the transition. And if you're developing services, I would say involve young people in your service design. Involve peer support, try and develop that. That's very, very important. And have a plan where you can review things annually. And that's very important. So just to conclude, certainly in the United Kingdom, our evidence supports that the transition experience isn't great. We've got a lot of work to do. We need to be starting early at the age of 12, not 17 or 16. The age at which you transfer to an adult service is dependent on how that young person feels and their maturity. We must communicate in an appropriate way that is appropriate for the age and the maturity of that young person, and providing psychological support for both the young person and their parents is really important. Mentorship is really important, so a key worker, peer support. We need to set goals and test people's knowledge so they really understand what their condition is about so they can make choices when they're older. And also in the adult services, we need to recognize the vulnerability of young people, and we need to be responsive and proactive and not let them disappear. We have to bring them back into the service. And finally, this is a commissioning issue, and we need to make sure that the funders of healthcare put in the right resources to make this work. So that's all I'm going to say. I'd like to acknowledge our multidisciplinary team, but also all the charities that have supported our service over the years. Thank you very much.